Most of us really like babies, maybe because of their cuteness or for being innocent. But this will not be the reason that we are ready to have a kid. But there are times that we can be able to stop this feeling of affections. Too much love turns into our greatest mistake. What I mean is abortion. To prevent this situation, come on and watch the video about the methods of contraceptions. Artificial method. Artificial methods in common use include preventing the sperm from reaching the ovum using condoms, diaphragms, etc., inhibiting ovulation using oral contraceptive pills. Examples of artificial method. First is oral contraceptives, also known as the pill. Oral contraceptives contain synthetic estrogen and progesterone. To use the pill, it is recommended that the woman takes the first pill on the first Sunday after the beginning of a menstrual flow, or the woman may choose to start the pill as soon as it is prescribed. Advantage and disadvantage of this method. Advantage: it does not interrupt sex. It usually makes your bleeds regular, lighter, and less painful. It reduces your risk of cancer of the ovaries, womb, and colon. It can reduce symptoms of PMS or premenstrual syndrome. Disadvantages: adverse effects include nausea, breast tenderness, breakthrough bleeding, amenorrhea, and headaches. Oral contraceptives do not provide protection from STDs. Daily administration is necessary, and inconsistent use may increase the failure rate. Side effects. Side effects for OCs are nausea, weight gain, headache, breast tenderness, breakthrough bleeding, vaginal infections, mild hypertension, and depression. This is the picture. Next is transdermal patch. The transdermal patch has a combination of both estrogen and progesterone in a form of patch. Remove the patch from its pouch and peel off half of its protective liner. Place the adhesive side on the skin, then peel off the other half of the liner. Press the skin patch firmly with the palm of your hand for at least 30 seconds, making sure it adheres to the skin, especially at the edge. Advantage and disadvantage. Advantage: transdermal delivery offers several benefits over oral delivery, including smooth, continuous drug delivery, increased bioavailability, and reduced drug-drug interactions. Patches can be easily applied by the caregiver, and they provide a visual cue that the medication has been administered. Next is disadvantage. The main disadvantage to transdermal delivery systems stems from the fact that the skin is very effective barrier. As a result, only medications whose molecules are small enough to penetrate the skin can be delivered by this method. Side effects: bloating or swelling of the face, arm, hands, lower legs, or feet, swelling, burn, or blisters at the patch site, tingling of the hands or feet, unusual wet loss. This is the picture of the patch. Next is vaginal ring. The vaginal ring releases a combination of estrogen and progesterone and surrounds the cervix. This silicone ring is inserted vaginally and remains there for 3 weeks, then removed on the 4th week as menstrual flow would occur. Advantage and disadvantage. Advantage: if used correctly, the vaginal ring is more than 99% effective. One ring provides contraception for a month, so you don't have to think about it every day. You can continue to have sex when the ring is in place. Wow! Unlike the pill, the ring still works if you have sickness, vomiting, or diarrhea. Side effects: it may cause temporary side effects such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood changes. The ring doesn't protect against STs. This is the picture of the vaginal ring. Next is subdermal implants. The subdermal implants are toe rod like implants embedded under the skin of the woman during her menses or on the seventh day of her menstruation to make sure that she is not pregnant. Inserted beneath the skin of the upper arm, the implant releases a progestational hormone to prevent sperm from reaching the egg. Advantage and disadvantage. Advantage works for 3 years. Wow, it's been a long. It doesn't interrupt sex. It's an option if you can use estrogen based contraception, such as combined contraceptive pill, contraceptive patch, or vaginal ring. It's safe to use while you're breastfeeding. Disadvantages of the contraceptive implant include it offers no protection against sexually transmitted infections. Side effects: amenorrhea, light or irregular bleeding, frequent bleeding episodes, more than 5 in 90 days, continuous bleeding for weeks, more than 14 days, occasionally menorrhagia. This is the picture of the implant. Next is hormonal injections. A hormonal injection consists of medroxyprogesterone, a progesterone, and given once every 12 weeks intramuscularly is given as an intramuscular injection into the buttock or the upper arm, and over the next 12 weeks, the DMPE is slowly released into the bloodstream. To prevent pregnancy, an injection must be given every 12 weeks. Advantage and disadvantage. Advantage: it may reduce heavy, painful periods and help with premenstrual symptoms for some women. Disadvantage: your periods may change and become irregular, heavier, shorter, lighter, or stop altogether. This can carry on for some months after you stop at the injections. Side effects: you may experience side effects like headaches, acne, hair loss, decreased sex drive, and mood swings. This is the picture. Next is intrauterine device. An IUD is a small, T-shaped object that is inserted into the uterus via the vagina. It prevents fertilization by creating a local sterile inflammatory condition to prevent implantation. To put the IUD in, the nurse or doctor will put a speculum into your vagina and then use a special inserter to put the IUD in through the opening of your cervix and into your uterus. The process usually takes less than 5 minutes. Advantage and disadvantage. Advantage: it protects against pregnancy for 5 or 10 years. Wow, so for long, depending on the type. Disadvantage: it has minor and major drawbacks such as menorrhagia is a frequent complaint, as are dysmenorrhea and polymenorrhea. Side effects such as acne, headaches, or breast tenderness. This is the picture. Next is chemical barriers. Chemical barriers such as spermicides, vaginal gels and creams, and glycerin films are also used to cause the death of sperms before they can enter the cervix, and also lower the pH level of the vagina so it will not become conducive for the sperm. Spermicides are sperm-killing chemicals inserted deep into the vagina near the cervix before sex. Advantage and disadvantage. Advantage: easily available and affordable condoms can prevent the spread of STDs when used properly. Disadvantage: effectiveness as a contraceptive is compromised when the condom is damaged or not used properly. Using a male condom requires a pause just before the sex act, resulting in people foregoing using it at all. The side effects is only the skin damage. This is the picture. Next is diaphragm. The diaphragm is a small, dome-shaped device made of silicone or latex that fits inside the vagina and covers the cervix. It must be used with spermicide. There are two types of diaphragms. Both diaphragms are available by prescription only. How to use: apply spermicidal gel around the rim and inside the dome of the diaphragm, the side that will face or be in count. Squeeze the rim or sides of the diaphragm between your fingers. Advantage and disadvantage. Advantage: it has no effect on your natural hormones. It does not affect milk supply if you are breastfeeding. Disadvantage: using of a diaphragm and spermicide may cause vaginal burning and irritation from the spermicide. Some people are allergic to spermicide or latex and may have a reaction. The side effects: use of a diaphragm and spermicide may increase the risk of urinary tract infection or UTI. This is the picture. Next is the cervical cap. The cervical cap is a small plastic dome that fits tightly over the cervix and stays in place by suction. It acts as a barrier to keep sperm from entering the uterus. It should be used with a spermicide. A healthcare professional must fit and prescribe the cap. The type available in the United States comes in three sizes. Apply spermicidal gel inside the groove between the rim and the dome of the cap in the bowl of the cap, and on the outer dome of the cap, squeeze the cap between your fingers with the inside of the bowling facing up. Insert the cap into the vagina with the long brim entering first. Press the cap onto your cervix until it is completely covered. The advantage and disadvantage: it has no effect on your natural hormones. Again, the same as what we're talking from the previous slides. It does not affect milk supply if you are breastfeeding. It can be inserted up to 40 hours before sex. Disadvantage: the spermicide used with a cervical cap can increase the risk of getting HIV from an infected partner. You should use the cervical cap only if you have one sexual partner and both of you are at low risk of HIV infection. This is very risky. Side effects: use of the cap may cause vaginal irritation or odor. There's some sort of infection, guys. This is the picture of the cervical cap. Next is the male condoms. The male condom is a latex or synthetic rubber sheet that is placed on the erect penis before vaginal penetration to trap the sperm during ejaculation. I know these male condoms are very familiar most of us boys. To use this condom, unroll condom all the way down the penis after sex, but before pulling out, hold the condom at the base, then pull out. While holding the condom in place, carefully remove the condom and throw it in the trash. Advantage and disadvantage of using this male condom. Advantage: proper and consistent use of condoms prevents transmission of sexually transmitted disease or AIDS. Wow. Condoms are easy to use and very little practice is needed. Disadvantage: excessive friction during intercourse may cause the condom to tear and result in an unwanted pregnancy. There are some sort of a little mistake. This can be avoided by waiting a while before covering the penis with a condom during sexual intercourse. However, this need for interruption of the act can be a mood killer. The side effects of using my male condom: it may lead to rash, hives, and a runny nose. In severe cases, it can even tighten the airways and decrease blood pressure. If you or your partner is allergic to latex, then you must opt over a polyurethane or lambskin condom. This is the picture of male condom. Next is female condom. If there's male condom, there's also a female condom. Now I know. These are also latex rubber sheets that are especially designed for females and pre-lubricated with spermicide. It has an inner ring that covers the cervix and an outer open ring that is placed against the vaginal opening. To use this, while holding outside of condom at close end, squeeze sides of inner ring together with your thumb and forefinger and insert into vagina. Advantage and disadvantage. Advantage: female condoms help to protect both partners from STIs, including HIV. When used correctly, they are a reliable method of preventing pregnancy. Disadvantage: female condoms are very strong, but they may split or tear if not used properly. They're not as widely available as male condoms and can be more expensive. Wow. Side effects of using the female condoms. Rarely, latex or rubber condoms can cause irritation for people with latex allergies or sensitivities, and sometimes the lube on certain types of condoms may be irritating. usual. This is the picture of the female condom. Wow, now I know. Next is the surgical methods. One of the most effective birth control method is the surgical method. The two kinds of surgical methods are used by either the male or the female and would ensure the conception is inhibited after the surgery for as long as the client lives. First type of the surgical method is vasectomy. Males undergo vasectomy, which is executed through a small incision made on each side of the scrotum. The vas deferens is then tied, cauterized, cut, or plug to block the passage of the sperm. So this is the picture of vasectomy. This is very PG. Next is tubal ligation. In women, tubal ligation is performed by occluding the fallopian tubes through cutting, cauterizing, or blocking to inhibit the passage of both the sperm and the ova. This is the picture. Next method is natural method. We're done the artificial method. Let's go to the natural method. First is the abstinence. This is natural method involves abstaining from sexual intercourse and is the most effective natural birth control method with ideally 0% fail rate. Whoa. For most people, abstinence means not having sex with anyone. It's a virginity, guys. Advantage: better health. You'll probably have fewer physical and emotional concerns. Certainty: if the relationship lasts without sex, there is a good chance it will be a strong relationship. Confidence: you'll know that the other person likes you for you and not just for sexual attraction. So guys, be careful with this. Next is calendar method, also called as the ready method. This natural method of family planning involves refraining from coitus during the days that the woman is fertile. This is the picture of calendar method. Next is basal body temperature. The woman must take her temperature early every morning before any activity, and if she notices that there is a slight decrease and then an increase in her temperature, this is a sign that she has ovulated. Advantage: basal body temperature can be used as a way to predict fertility or as part of a method of contraception by helping you gauge best days to have or avoid unprotected sex. This is the picture. Next is cervical mucus method. The basis of this method is the changes in the cervical mucus during ovulation to check if the woman is ovulating. The cervical mucus must be copious, thin, and watery. Advantage and disadvantage. Advantage: the cervical mucus method is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Disadvantage: the cervical mucus method does not protect against sexually transmitted disease. Also, several outside factors can change the look and feel of cervical mucus. This is the picture. Next is symptothermal method. The symptothermal method is simply a combination of the BBT method and the cervical mucus method. The woman takes her temperature every morning before getting up and also takes note of any changes in her cervical mucus every day. Advantage: the symptothermal method has a significant advantage in an effectiveness because it combines the calendar, cervical mucus, and temperature methods. This is the picture. Next is ovulation detection. The ovulation detection method is an over-the-counter kit that can predict ovulation through the surge of luteinizing hormone that happens 12 to 24 hours before ovulation. The kit requires the urine specimen of the woman to detect the LH. Advantage and disadvantage. Advantages: ovulation test kits may be beneficial if you have slightly irregular periods or find other methods of tracking your fertility difficult or unreliable. Disadvantages: ovulation test kits can be expensive and there are no guarantees. This is the picture. Coitus interruptus. This is one of the oldest methods of contraception. The couple still proceeds with the coitus, but the man withdraws the moment he ejaculates to emit the spermatozoa outside of the vagina. Disadvantage. The disadvantage of this method is the pre-ejaculation fluid that contains a few spermatozoa that may cause fertilization. This is the picture of coitus interruptus. That's all. Thank you. Presented by Mr. Vincent S. Tumulak. Alright.